Hi, good morning, everyone. I am Ian Frank M. Anok, and I am going to discuss to you the administration of oral medication. Our learning objectives. At the end of the lesson, the learners would be able to define oral medication, identify the purpose of giving medication, identify contraindications in giving oral medications, learn the process of giving medication, apply the knowledge gained into a real-life scenario. According to the annual report pharmacy program in the year 2017, the leading cause of patients' harm is medication error, which accounts for almost 6% of medical injuries. For our general rule, first, do no harm is the ethical imperative for every patient's safety effort. In working towards reducing the frequency of medication errors, priority should be given to prevent error which contribute any harm to the patient. Administering oral medication is a core function of nurses. The responsibility is to comply with safe medication use, process, and practice in order to prevent occurrence of medication errors and misadventures. Now, what is oral medication? It is administration of medication by mouth and ensuring that the patient swallow it. The purpose of giving oral medication is number one, to prevent disease, number two, to cure the disease, number three, to promote health, number four, to give a symptomatic treatment, and number five, to supply the missing component. For the contraindications, number one, we have the alteration in gastrointestinal tract, number two, immediately after surgical procedure, number three, patient who are unable to swallow, and last, patient has gastric suction in situ and before some test and surgery. Now the standard should be patient does not experience medication error during the hospitalization. Now our objective is all medications are served according to the 7 rights of medication administration, in which include right patient, the right drug, the right dose, the right route, the right time, the right documentation, and the right to refuse. Nurses exhibit the caring component during the administration of oral medications. Nurses document the medication administered accurately and completely. Articles required are the following. Of course, the medication ticket, the medicine tray, the medicine, measuring cup or the dropper, a glass of water, and a towel or sponge cloth. When preparing the client for administration of oral medication, first you need to explain the procedure, discuss the need for medication, assist client to sit if possible, give mouthwash if necessary, protect bedclothes and garments with towel placed under the client's chin across the chest. For the preparation, first you have to perform hand hygiene. Next, you have to check the label with the medication administration record. And for the solid preparation, pour correct amount of medication into the container lid, then into the medicine cup. For unit dose, open unit dose medication packet and place in the medication cup. For the liquid preparation, shake mixture or suspension before pouring. Follow the instruction on the bottle. A medication with an unexpected precipitate or a change of color is not to be used. Liquid medications together. When liquid medication is poured from the bottle, pour from the side of the bottle opposite the label. Set the medicine cup so that the mark of the prescribed amount is at the eye level. When setting up medication that requires the use of a dropper, the bottom of the meniscus is the point to measure. And last, wipe rim of the bottle with a paper towel and replace the cup. During the administration of the oral medication, greet the patient, identify right patient, verify prescription, assess the patient, and take appropriate nursing measures and document accurately. Dish out the correct medication using the three checks. First, before dishing out. Second, during preparation. And third is after the preparation. Next is explain and inform the patient. Listen, respond promptly and politely to patient's request or the questions. Next, serve and ensure the patient consume the medication. Next, document medication served or omitted. Next, monitor patient's response and document. And the last one is to take appropriate measures if adverse reaction is identified. Then, don't forget to do the aftercare. Thank you and have a good day.